corneal ulcer. For bacterial corneal ulcer, we also need urgent hospitalization. We can give topical antibiotic, moxifloxacin eye drop, 2, 4, or 6 hourly according to severity. We can also use moxifloxacin eye ointment at bedtime. We can give 1% atropine eye drop. We have to give oral ciprofloxacin 500 mg. Plus, we can give systemic analgesic, anti-ulcerant, sedative, vitamin C, and we have to say the patient to use the dark glass and do not use water on face. If the corneal ulcer is caused by virus, then we have to use again 1% atropine eye drop. We have to keep in our mind for every kind of corneal ulcer, we have to give 1% atropine eye drop. Then we can use for children acyclovir, and for adult patient we can use acyclovir 5 times daily for 21 days. And we can also give oral acyclovir 1 gram TDS for 14 days. Next, we have to know the treatment of fungal corneal ulcer. For fungal corneal ulcer, we have to use topical antifungal agent 5% natamycin, 2, 4, or 6 hourly according to severity. We can use clotrimazole eye ointment 5 times daily, 1% atropine eye drop, and systemic antifungal agent ketoconazole, systemic analgesic, and if we suspect there is any bacterial inflammation or corneal ulcer, we can give antibiotic eye drops. Now, we have learned about corneal ulcer. If the inflammation is intraocular, I mean if the inflammation is in iris or ciliary body, we have to know the treatment of uveitis. For uveitis, at first, again we have to use topical mydriatrix atropine 1%. Then steroid we can give in topical, periocular, intravitreal, and systemic route. We can also give systemic immunosuppressant agents and treatment of underlying causes. We can give hot compression, and obviously we have to use dark glasses. And last, the acute emergency that needs immediate medical treatment, that is acute closure, angle closure glaucoma or acute congestive glaucoma, because without proper treatment the patient will become blind, so you need immediate medical treatment. For that, first we need immediate hospitalization. We tell the patient to lie on supine position. Then we give tablet acetazolamide 250 mg, 2 tabs cut, and 1 tab for 6 hourly. Then we give a beta blocker, eye drop timolol 0.5%, 12 hourly in affected eye. We give a steroid dexamethasone on drop 6 hourly in affected eye. We give another eye drop pilocarpine 2%, 1 drop 6 hourly in both eyes. Because you can ask why we use on both eyes where the congestion is only one eye, because the other eye may be in latent or intermediate glaucoma. Then we have to give antiemetic, analgesic, and sedative. Then if intraocular pressure does not fall less than 35 mm mercury, we have to give 20% mannitol 5 ml per kg body weight intravascular over 30 to 45 minutes. After that, we need to do gonioscopy after 48 hours. If peripheral angle and anterior synegia is less than 50%, we have to do peripheral iridectomy both eye. And if more than 50% of anterior synegia is present, we have to do trabeculectomy of affected eye. That's all about our treatment. So let's recall the first scenario. The patient has come to you and told, "Doctor, will I lose my eyesight?" But now you have given him the proper treatment. After a few days, he came to you with a bag of fruits and said, "Doctor, alhamdulillah, I'm totally free from my disease, and may Allah bless you." So it is a thing for that we practice and we learn this kind of treatment. So that's all from our team. Thank you, everyone.